Hi guys, Dr. Stu Katzen here with the next episode of our video series. What we're going to be talking about today is about neck pain. Another very common thing that we see in the chiropractic office, also common with the athletes we work with here in the office. Now, to understand neck pain, it's important to understand the anatomy of the neck. Now, there's 26 bones in your spine, 7 of which are in the neck. Each one of these bones are freely movable. Now, between each pair of bone, you also have what's called a disc. The disc has two purposes. One's for shock absorption, the other creates space between the bones so the nerves can exit. So they're very delicate nerves in a very small space here, so normally aligned, everything's functioning properly. However, due to poor posture, poor sleeping habits, strenuous exercise, slips and falls, traumas, car accidents, misalignment, sporting injuries, the spine can and does come out of alignment. If it comes out of alignment, it starts a whole series of possibilities. One is the joint itself could be irritated, so they have joint inflammation or irritation. It could also pinch or irritate a nerve, so it could be nerve irritation. It could also strain or sprain the muscles of the neck, and that can cause its own host of problems. It can also be a combination of these different things. You have a series of nerves that come out of your neck. These nerves also go down into the arm. So if you look here at this poster, all these nerves that come out of the neck go into the arm. So I've had patients sometimes have numbness and tingling in their hand, and they think it's a wrist problem, but more times than not, you trace it back up, it can be irritated here from the nerves in the neck. The brain sits right up here. Off the brain is the spinal cord. Off the spinal cord, you have 31 pairs of nerves throughout the spine, 7 of which are at the neck. So if there's any misalignment in the neck, you can irritate those nerves. So again, an evaluation would involve checking range of motion, flexibility, orthopedic tests, neurological tests, reflexes, to see what's actually going on here and rule out whether it's a muscular problem or a joint problem or a combination of problems. It could also be a disc problem. In an early video, I described the anatomy of a disc briefly. The disc's like a jelly donut. The middle of the part is jelly material, the outer part is cartilage. If there's any bulging of that middle part to the outer part, that can cause pain and discomfort. It can also cause bulging of the disc, which can then bulge on the nerve itself. So we want to rule out, make sure there's not a disc problem. Now, these things could occur due to strenuous exercise, trauma, coming down on our heads, car accidents. Another big common cause nowadays is forward head carry. A lot of people wearing backpacks, sitting on computers, driving their cars, kids with their video games, text messaging, all puts you up about a 13-pound skull, and leaning forward all day long put a lot of tension on the joints, a lot of tension on the nerves, a lot of tension on the soft tissue structures, a lot of tension on the alignment. So we also want to make sure, structure dictates function, so we want to make sure that everything's lined up properly, remove any obstructions, any tension. If there's a muscular component, address it. And if we can't address it at the office, we make sure we find the right healthcare professional for you to see and rule out what's going on. And then in the future videos in this series, we're actually going to show how I actually do a treatment for someone who has neck dysfunction. And then the following video is on how you can self-care, how you can do mobility, stretching, flexibility, strengthening on your own, and self-care. So I hope you found this informative. If you have any questions, don't hesitate to find me at CrossFit or call the office directly.